Well, thank you very much. Aloha to everyone. Chaminade University of Honolulu School of Nursing and Health Professions is really happy that you joined us today. We're doing a series of healthcare forums, each time with different speakers from our community who can share their ideas with us, what's going on in their organizations. We started last spring and we'll be going through this spring. So please watch for future healthcare forums. And we're also interested in knowing if you would like to be a speaker, a panelist, or if you have an idea that you would like for us to cover in a future forum. And you can put that in the chat if you'd like, or follow up with us later. I'm Roberta Haley. I'm the Dean of the school, and you just heard from Dr. Pamela Smith. She's the Associate Dean and also directs our new Doctor of Nursing Practice program. So again, welcome. It's a pleasure to introduce our panelists. I'll start with that so you know who's talking with you today. Justin Puckett is the Hawaii market leader for Humana, where he's responsible for the development, expansion, and management of Humana's business presence, strategic growth, and provider engagement. His purpose and passion is to transform the way healthcare is perceived and delivered in Hawaii. Prior to Humana, Justin was at Hawaii Pacific Health and Kaiser Permanente. As a founding member and current president of the Hawaii Young Healthcare Professionals Group, he is building and supporting a collective network of emerging professionals in Hawaii who can positively affect the health of our communities. Matt Sasaki currently serves as the Director of Government Relations for HMSA, where he is responsible for leading its engagement with federal, state, and county government agencies and representatives. Prior to his current role at HMSA, Matt served in leadership roles handling health services, care management, and provider partnerships. Having spent his entire career in Hawaii's healthcare landscape, Matt is focused on the improvement of health in our community. Colby Takeda is the co-founder and CEO of Pear Suite, which he oversees operations, product development, and strategic partnerships. Colby brings his diverse background in public health, senior living, and digital health to support Pear Suite's focus on addressing the social and environmental drivers of health, especially for older adults. Passionate about developing the next generation of healthcare leaders, Colby also teaches courses in community health at Chaminade University. He serves on multiple boards, and that includes the Hawaii Public Health Association. Katie Page is a nationally certified family nurse practitioner. She currently serves as the director of Waiola Clinic, an open access primary care urgent walk-in care clinic that is part of Waianae Coast Comprehensive Health Center, a federally qualified health center located in Waianae, Hawaii. She also serves as the program director of the Nale Kukui's NP residency program. This is a one-year postgraduate training program for nurse practitioners, and she's been in that role for the last 3 years. Dara Kahani is the executive director of Project Vision Hawaii, an organization that provides mobile health, hygiene, and social services to rural and houseless communities across our island state. Since March of 2020, Project Vision has played a crucial role in the fight against COVID-19 for vulnerable populations in Hawaii and offers a mobile health screening program that provides statewide services in communities with significant access to care, challenges related to income, lack of insurance, geographical location, or cultural conflict. DARE has also served villages across the globe, establishing sustainable clinics, coordinating medical education, and providing site-saving ophthalmic surgeries in over 20 countries. I think that's everyone. And what I'd like to do now is move into some questions. We will be watching the chat. So if you are thinking of something that you want to add to the conversation, please go ahead and chat us during the panel. I'm going to start with just a general question that I think all of us might want to think about and add our ideas. And that is, for each of you, how do you see the healthcare landscape changing here in Hawaii? And Matt, why don't I start with you?
Sure. You know, that's a really good question, and it's probably a question we could spend maybe the entire hour on. But, you know, just in short, you know, I think the answer to that is there's kind of two parts to it, right? There's a pre-COVID aspect of how the landscape was changing. There's a post-COVID aspect of how the landscape will change. to try and just sum it up from my perspective, I think it kind of comes down to maybe just a few buckets that we can definitely dive into deeper. And I'm sure folks on this call would probably have similar inputs on. But the landscape is going to change because there's going to be different vehicles of healthcare ranging across the spectrum of acuity. Outside of that, we're going to see utilization of different providers working to address our growing population because we cannot rely on only one subset of providers. And then beyond that, it's probably this wave of disruption that's going to be coming from digital solutions. We're all seeing how that's playing out in different industries and different markets. Healthcare is not going to be any stranger to that in the future. And outside of that, I think it's a shifting focus when it comes to preventative care as opposed to reactionary curative care. And looking downstream is how can we focus on affordability and prevention.
Thank you. Katie, what would you like to add to that?
That's well said. I agree with many of those concepts. And the thing that I'm seeing at our health center is this move towards a team-based approach to providing care. So utilizing not only but nurse practitioners along with ambulatory care nurses and medical assistants, and also utilizing case managers and social workers and houseless outreach services, along with our health maintenance workers that work on tobacco cessation and other things to provide this patient-centered approach for overall health. So I really see a move towards this team-based approach towards providing medical care to patients.
Thank you. Justin, what would you like to add to that?
Yeah, thanks for the question, Roberta. I see an even greater focus of partnership between healthcare providers, delivery systems, health plans, and community-focused organizations to share analytics and insight, which will drive improved quality of care, access, and affordability. These shared analytics will be critical components to support the movement of team-based care that Matt and Katie previously spoke about. I believe the future of healthcare is about doing things together, aligning interests and analytical capabilities. And I think the future is very bright for companies who can successfully engage members and patients to help them understand the whole person and member rather than only the patient.
Colby, your ideas on this?
Yeah, as we're seeing both with the response of COVID and just generally, we're seeing a lot more of the community health initiatives sparring up as a focus of health plans and health providers. I think we're seeing not just a different delivery care system with urgent cares and mobile clinics, but also the use of how do we utilize our community health centers better? How do we go into the communities and do place-based health? What are farms and urban landscapes and transportation options and all these social determinants of health and public housing sites have to do with health, and how do we utilize them to really boost well-being and outcomes for families of all backgrounds and populations? So more place-based health. Thank you.
Dara?
Yes, thank you. So I just wanted to share, everyone covered most of the topics, but I wanted to give some concrete examples if that's okay. I'll brag a little bit about our team at Medicaid who helped to bring down some CHIP funding recently to encourage the school-based health system. And so we're seeing a lot of changes within our federal capacity, bringing that down to the state so that we can utilize those funds to pay for services within the school. And I think that's really important, that idea of bringing healthcare to people where they are. And that, that's for our students, that's for our houseless community, that's for those in public housing that need to be home to watch their kapuna or their keiki. Just being able to bring services through mobile healthcare units or in-home visits or through telehealth, all of that's going to be important going forward.
Okay, so I heard some overlapping themes around prevention, a team-based approach, coordinating care, strengthening our partnerships, the use of data and analytics, health initiatives, place-based care, and really looking out for the most under-resourced of our fellow citizens here in Hawaii. Let's go on to our next question. How has your organization found ways to increase access to care? And how does this help with health equity? Katie, do you want to start with that?
Okay, yes, great. One of the biggest ways that I think us at the Nurse Practitioner Residency Program have facilitated access to care is by creating new providers that are willing to work in underserved settings, be it rural or not. And we've graduated 31 residents since our inception in 2015 when we first started the program. So we're very proud of that fact that we created 31 new well-trained nurse practitioners that are ready to take care of the complex patients that you find in community health center settings. In addition, 23 of those providers have remained in the state of Hawaii. And out of our graduates, 17 are still working in federally qualified health centers. There's two things that we do in our training to address health equity and health disparities. The first being our quality improvement project that each group of residents carries out. So last year, a group of residents found that our depression screenings, our scores were low on compliance rates of completing depression screenings on all our patients. And so they created a project, a new initiative within our clinic to screen every patient that walked through the doors. And so we went from like a 40% compliance rate up to 85% by the end of the year. So it was a really effective tool and initiative that they underwent. The second thing that we started doing last year was adding an annual rural health project where we travel to our islands and kind of engage the residents to work in a rural health setting. So last year, our project, we traveled to the Big Island at Hamakua Health Center, and we gave COVID-19 vaccinations to the patients at the center and other community members that needed to be vaccinated against COVID-19. So we're trying, and then we had two of our graduates are working at FQHCs on outer islands, one on the Big Island and one in Maui. So it's great to see the continued commitment of the NP resident graduates in rural settings and also working in underserved communities.
Two great examples with an immediate positive effect. Good for you. Colby, would you like to tell us what you're up to?
Yeah, sure. Just a little background about PearSuite. So we're a new digital health organization that works with health plans, providers, and community organizations to improve well-being, boost independence, and reduce healthcare costs through the use of virtual community health workers. And so when we look at the pandemic that we're going through right now and the need to get better information to people who are less resourced, maybe they have language barriers, they have challenges with being able to physically get to clinics or get their vaccination. We utilize virtual communication tools like phone and video conference to reach out to different members of the community and reach them in trusted ways. So rather than just going straight to these organizations and these members, we actually went through faith-based organizations. So we worked with Catholic churches across the state, specifically with the Filipino population. And we found Filipino community health workers to reach out to them and give this friendly handhold through the process of understanding what the vaccinations are all about, how to get them, and actually make sure that they have all the resources they need to get to the vaccination site, whether it's transportation, whether it's more information. And of course, when there's cases when they can't leave, that's when organizations like Dara's group can actually do home-based visits. And so try to overcome those social determinants of health to increase access and increase equity across the healthcare system.
Great. Dara, do you want to just build right onto that?
Yes, thank you. So within Project Vision Hawaii, we have mobile clinics and mobile hygiene units, and we've used those for over a decade now to bring those services out to the community. And even more so during COVID, we've been able to utilize our flexibility and mobility aspect to go right into people's homes, like Colby mentioned. I wanted to answer this question with the use of grassroots organizations. That has been a huge, those have been huge partners for us in this COVID response, and each of them led by minority leaders within the public housing units, for example, the churches where people feel most comfortable. We've been partnering with many organizations like the Marshallese Community Organization of Hawaii, who have, obviously speak the same language as their people, have the same cultural aspect, and have been able to provide COVID education in that manner in a way that's culturally sensitive to their people. We've been also working with the Filipino Community Center, many of our Native Hawaiian Pacific Islander groups, and have really seen that by encouraging people to do that outreach themselves, that has helped us to increase access to care for those specific targeted communities.
Thank you. Justin, do you have anything you want to add to this question?
Yeah, absolutely. Humana's Medicare Advantage plan is really focused on health equity and improving access, and really main ways of developing our benefit design, our plan offerings to support access. One is we actually provide transportation benefits to all our members to get to medical appointments when they need it. Second is really offering kind of robust mail order pharmacy offering, where we actually waive the copays for tier 1 and tier 2 drugs, because it's affordability is a big component of access, and we want to do our point in driving healthcare affordability for our members, as well as helping them get care where they need it.
Great. I think the themes that I captured out of that were taking action when and where it's needed, building trust, leveraging organizations that are already in place. So coming alongside trusted organizations and building on what they're already doing in partnership, and finding gaps and filling those gaps. Okay, we'll go on to our next question. How does your organization focus on the social determinants of health in what you do? And why don't I just start with you, Matt?
Sure. So, Justin already talked about the role that SDOHs play in the community. I think everybody has touched on it as well. So for our organization, this is a very important element for where HMSA can support the community as a health organization in the future. SDOHs is, I don't want to call it a buzzword, but it's definitely a newer subject matter right now across the healthcare industry. And it's something that we are focused on learning more about and finding ways to implement. So we have a great team here that's staffed and supported with clinical staff and non-clinical staff, and in addition to policy folks, to help understand that where can we make connections in the community, where can we engage, and where can we support in order to touch on those items that maybe aren't necessarily 100% aligned with a clinical outcome, but where the role of food security, housing security, all those elements are so important, especially in a place like Hawaii, where if you've seen our most recent ALICE reports, it is staggering as to the impact on our children, especially in a post-COVID environment. So those are some ways that we're looking to support this effort.
Thank you. Justin, do you have something to add to that?
I think Matt summed that up really well, and I think just kind of touching on Humana's focus, like we've performed over 2.5 million social determinants of health screenings for members to really understand their situations as well as the wider communities that we serve. And on a national level, Humana has a bold goal initiative where we're really focused on a specific community or city level, a social determinant of health, where we bring in a project management focus. And that's something that we are exploring and expanding to Hawaii.
Okay, thank you. Katie, do you have something to share?
Yeah, I would just like to give a concrete example of how we utilize social determinants of health in our clinic setting. We just started rolling out a socially determinant of health survey that's given to every patient that walks through the door. And it identifies things like food insecurity or transportation issues. And if those two things are identified as a need, we started where the providers can actually write a prescription for them to get produce coupons at local farmers markets to help them make healthier choices and actually address their food insecurity. On top of that, if a need is identified for transportation issues, we work with the health plans such as Humana and HMSA and other healthcare plans to arrange transportation to appointments that are outside our facility, such as a cardiologist at another hospital on the island. We do have a transportation van within our health center that will take patients to appointments within our health center, but it's great to have that support from the health plans to address when a transportation need is identified. So those are two examples where we're directly trying to engage with patients and identify these needs and help meet them.
Nice. Colby, what would you like to share?
Yeah, sure. And just for those who aren't aware, it's interesting, about 90% of current US healthcare spending goes toward just curing sickness, even though a majority of what drives our health is things like the physical environment, our social factors, health behaviors, and these are often ignored in the traditional healthcare settings. So it's exciting to see some of these organizations kind of incorporate more of these social drivers of health, whether it's language barriers, food insecurity, social isolation, loneliness, even financial instability are all things that could affect how much we're spending and how we're actually addressing these health outcomes. And I think beyond that, just identifying those challenges, then it's how do we actually address them? And I think that's where a lot of the organizations are stuck. There's a lot of things they can do outside of the clinic, the four walls of your clinic. And it's a matter of, is it my role? What organizations can step in and help out with them? which I think is where collaboration is really important. How do we utilize organizations already in the community who are ready to provide transportation, who are ready to address food insecurity with SNAP benefits, who are ready to support technology literacy, rather than the health organization taking on all those roles. So it's exciting to see organizations like Katie's and Dara's kind of going on the field and partnering with groups that can actually lend a hand and provide that friendly handhold through some of these processes, like getting registered for SNAP or getting onto broadband.
I think this is such a central question to today. I want to make sure that I include Dara. Did you have something that you wanted to add to that conversation?
Absolutely. As you know, one of the nonprofits that's out in the field, we couldn't do it without the support of the MCOs. So I just wanted to note again, with the Medicare adding on to their CIS program this year for housing solutions, I think that's an example of how everyone is looking at how to address the social determinants of health, and to be able to get reimbursement for our people that are out on the streets every single day interacting with our houseless community, having some sort of reimbursement so that our nonprofits can have more sustainability. Those types of things make all the difference. So our nonprofit, we've adopted a holistic approach in putting on health fairs. Obviously, with our name, we come from an ophthalmology, optometry background, but we knew that vision screenings weren't all that we should be providing when we have that engagement with individuals. And so now being able to add on, a focus in housing and food insecurity, workforce development, family planning, all of these things make a difference in the overall well-being of a person. And so it's so great to be able to work with partner organizations and to have that collaboration between organizations that do like work. And that really is all of us combined together can make that move forward possible.
Justin, did you have a message that came through the chat that you wanted
Yeah,
to?
I did. I can answer the question from Katie. Thank you for the question, Katie. And I can't speak to other plans, but for Humana, we do offer the transportation benefits for our PPO premium plan membership. And the best way for them to kind of get access to that is calling the number on the back of their card and working with our team to get that benefit utilized and realized.
Okay, so I heard some themes around food insecurity, housing issues, that we're surveying patients to make sure we get their point of view, transportation, doing concrete actions like writing a prescription, taking into account language and finance barriers, and that there can be challenges between identifying the barriers and actually addressing the issues, and that we are building partnerships and helping each other to address those. Our fourth question for the panelists is, with the primary care shortage in Hawaii and throughout the US, how do you see nurse practitioners contributing to those solutions? And Katie, can I start with you?
Sure. Like I said before, we've had 31 graduates from our program over the last 7 years, and over half of those have actually remained working in primary care. One of the reasons why we started the program at our health center is that nurse practitioners were not lasting very long. They were burning out. There was a sink and swim kind of atmosphere, and they weren't really prepared once they graduated to take care of the highly complex patients that are located at our health center. So having postgraduate training programs from nurse practitioners has just been a key thing for our facility. And I think across the nation, you're seeing this, that these postgraduate training programs are able to provide nurse practitioners that are proficient at primary care, and they're willing to stay and work in a very difficult job. And the other thing is like, we got HRSA funded, we're partially HRSA funded a couple years ago, and the federal government is really working on workforce development across the nation, and nurse practitioner residency programs are part of that. So I think it's a big thing that you'll see in the future, that there's going to be more and more nurse practitioner residency programs, both here in the state of Hawaii and across the nation. And then the other thing about increasing access is that one of our we include many opportunities to have contact out in the community with patients, and they all go out with our houseless outreach van. And one of our graduates did was so great with the patients. After he graduated, he stayed on with our houseless outreach team, and he goes out and provides primary care services actually at the like out at the Waianae Boat Harbor and other places where houseless patients live.
Nice, thank you. Dara, do you have anything to add to that?
Love what you're doing, Katie. Thanks so much for sharing. I just wanted to congratulate Dr. Pam Smith, who's put all this together for us and her new doctorate program. It's been incredible, and Project Vision, Project Vision is a direct beneficiary of that program because one of our nurses is in the doctorate program doing a psych focus. And we're really excited about having her on board because we're developing a new program around her. And we're really excited about this, growth and breadth of the healthcare team. As a nonprofit organization at the height of the pandemic, when we needed desperately more nurses, more people to be able to help us COVID test within the shelters, within the incarcerated communities, all of those congregate settings that we were assigned to, it was very difficult for us to find RNs. And so we had to get very creative. And we're really grateful that Chaminade has the community health worker program. And we've been also working with HPH's CCMA program. So we're grateful. We may not have been able to find nurses and compete with the larger organizations here, but we've been very blessed to have other members of the healthcare team join us and to be able to serve our community.
Thank you for that. And also for Katie Kemp's comment in the chat. Pam, you might want to step in on the panel and just address why we started the nurse practitioner program. We didn't just do it on a whim. How did we base our decision, if you want?
Well, absolutely. Yes, thank you. We looked at the workforce needs of Hawaii, particularly across all of the islands. And what the data indicated was that we need more primary care providers and more providers in psych mental health. So that prompted us to begin this graduate program, Doctor of Nursing Practice program, with a family nurse practitioner track, as well as a psychiatric mental health nurse practitioner track. And this week is actually National Nurse Practitioner Week. So it gives you an opportunity to learn more about what nurse practitioners do, how many there are across the nation, over 350,000, and how nurse practitioners really meet the needs of patients and communities in rural settings as well as urban settings. So here in Hawaii, we specifically generated or started with those two tracks because that's where the needs are. And I think COVID has really amplified that point. Thank you.
Absolutely. Does anyone else want to add anything on our NP question?
I think I had a question that I can address in the chat. The question was from Carrie asking, what other ways can we encourage NPs to work in primary care other than the residency program? I do think the federal government support for with the increased attention in primary care services and preventative services rather than focus so much on, care after the fact, after, they're already critically ill. I think as our health system focuses more and more on preventative services, that it will help keep it'll help invigorate nurse practitioners to work in a primary care setting.
I will just add, as a nurse practitioner for over 40 years, there's just been incredible growth in what NPs are doing and all the different settings where they add value, and the scope of practice and all of those things that help to support nurse practitioners to take care of vulnerable patients has just grown remarkably over 40 years. And I just want to say thank you to anyone who's listening today who's been part of that, because it's been a great effort and patients have really benefited from that so much. Okay, yes, NP week. So very nice reminder. Let's go on to our next question. How have you seen technology and telehealth evolve since COVID? And how has it provided greater access to care? And Colby, do you want to start with that?
Sure, I'd love to. So Suite definitely utilizes some of the the amazing technologies of telehealth, both through video conference and phone conversations. We're able to interact with members regardless of their location, regardless of their access to technology because of phones. We're kind of dumbing it down a little bit. People don't have broadband, may not have access to telehealth through video conferencing, but if we can just call them and get information from them via phone, we can actually increase access. How do we use texting? How do we use email? So we're expanding this through an omni-channel system. We're also seeing that a lot of the delivery needs to be followed up with. So how do we use nudging from texting to make sure that they're reminded about appointments or reminded about upcoming events? How do we give them resources like connecting them to local farmers markets or local senior centers or different community centers to get access to care? So that follow-up is really important. And we're also seeing on the other side, not just the members and the patients, but the workers want to be telehealth as well. They want to be able to engage with their patients remotely from their home. And so this is actually providing some support for those workers who maybe not want to be in the clinic or want to be in a comfortable setting and take care of other things at home, like caring for a loved one or taking care of a child. It's providing other options for careers as well.
That makes sense. Katie, how are you using telehealth?
So when the pandemic first hit, we just started doing telehealth visits right away, and we recognized the need for like formal telehealth training for our new providers. So we we take part in a 2-week formal telehealth training course through Old Dominion University. Right from the minute they're in our clinic, they start doing a mixed model of face-to-face visits and delivering telehealth through televideo and telephone services. So they learn how to assess through the video, how to assess a patient, and also like telehealth etiquette, don't eat when you're doing a patient visit and things like that. So it's been a really great growing thing, and I don't see telehealth going away. I initially thought, oh, this will only last for a short period, but our patients love it, and some of the providers really love providing care that way also, as mentioned previously. So that's been, we're all on board with telehealth services as part of our program.
Wonderful. Justin, what do you want to add to that?
Yeah, putting my health plan hat on, of course, everyone's aware we've seen an explosion in telehealth utilization across the country. And kind of the benefit design is really kind of flexing to that, offering $0 copays for urgent care telehealth or telehealth appointments for behavioral health. So I think that's going to continue. Really, how do we improve access and affordability of these telehealth offerings to really make sure our members and patients get the right care at the right time and the right place? And kind of from a bigger perspective, we're also seeing that this really greater adoption of telehealth is actually ensuring members are getting the right care in the more appropriate setting. And we're seeing kind of a reduction in unnecessary inappropriate utilization, such as ED visits and urgent care. And that's actually a really exciting trend because that's going to support overall healthcare affordability in our community and improved access for the people who really need access to that higher acuity and level of care.
Absolutely. Matt, would you like to add to that?
Yeah, thank you. It's funny to say that there's a silver lining from the pandemic for COVID, but I do think that one of those silver linings is probably the solidification of the role that telehealth will now play in care delivery, because actually telehealth isn't necessarily a new thing. It's been on for quite some time. And HMSA actually, just to toot our horn a little bit, was actually the first plan in the nation to launch a comprehensive telehealth platform with American Well. But when we look at the data of pre-COVID and then just the utilization during COVID, it's amazing to see how those two buckets almost match each other, just from that huge uptick in utilization. And I think because of that, that has proven a great point, and Justin and Katie and Dara and Colby have all kind of touched on this, is how we can use telehealth to support care in our community, to improve affordability, improve access. I will say that you can never replace a face-to-face interaction between a patient and a clinician, but you can support that and you can complement that. And that's the way that telehealth, I think, is going to help change and evolve our industry and help support our community.
No, I agree. And I'm hearing increased satisfaction, increased access and affordability, right care at the right time in the right setting. And I will say, even as a patient, it feels face-to-face in a lot of ways. I think the difference in having video has been very helpful as opposed to kind of the phone call methods of the past as both a provider and a patient. All right. Here's our next question. How do you see the importance of engaging in preventative health and screening and wellness visits? So just kind of speak to those areas. Colby, do you want to start?
Yeah, I think it's really critical. I mean, for us to understand and try to address the barriers to entry for healthcare system through the social determinants of health, we have to do the screenings first. We have to understand what the challenges are, and not just the surface level challenges. Like, yes, they have food insecurity, but what's leading to that? Is it they don't know what's around them? They don't know how to use their SNAP benefits. Are they even enrolled in SNAP benefits? Do they know that they have to renew it every year? All of these underlying challenges that could be barriers, if we can understand those, we can actually work to address them. And so I think these screening tools, different preventive measures, kind of being proactive can be really helpful in trying to get to those underlying effects that are leading to long downstream healthcare costs and health disparities.
Dara, do you have something to add to that?
Well, sure. Sort of combining the last two questions. During COVID, we saw the importance of the power of apps, I guess, rather. We quickly created, with the help of the Department of Community Services and with the Hawaii Community Foundation, worked on an app that allowed our houseless community to be able to access their COVID information, basically their test and their vaccine informations. And we were giving out in this pilot project, giving out phones so that they could access that information. And we wanted to see how that would work in being able to engage our clients more often, more frequently, and being able to utilize this app to bring people into screening events that we were hosting. So obviously with our vision screening program throughout the Department of Education statewide, we definitely believe in the power of utilizing screenings to bring people into a healthcare setting, and using that as a way to make referrals and to encourage individuals to participate in annual checkups. And so, that's been a helpful model, but also I think going back to that technology question, we've seen the quality of handheld screening machines. We utilize many of them in our international work. So when we take everything that we need with us in our suitcases, and the portable microscopes that we're able to take now for cataract surgery, for corneal transplants, now the handheld machines that are the size of our laptop that we're able to take for topography screening so that we can look for keratoconus in our keiki. We've just been able to jump through a lot of hoops to make this availability of screenings more frequent, more prevalent in our communities.
Wow, those are great examples. Katie, what would you like to share?
Oh, I just think that's all really great. And again, like I said, the residents are doing primary care, a lot of wellness visits. We have seen some challenges with the COVID-19 pandemic on, things such as colonoscopies being delayed and paused during upticks with the Delta variant and things like that. But things are starting to come back online, and it's just so important it really points out how important it is, how important wellness screenings are in death prevention. If we don't have the capacity to do these wellness screenings, we may miss something like colon cancer. So it's just really, the pandemic really has just made it even more important to get how important wellness screenings are.
Thank you. Matt, do you have something to add?
Yeah, I think a lot of good stuff has been said, and I agree with all of it. And I mentioned a little bit earlier preventative healthcare versus curative reactive healthcare, and it's kind of that adage of ounce of prevention, outweighing a pound of cure kind of thing. And I'll pick on Dara here because of the great work that her team has done. And you look at something like diabetic retinopathy, and an early screening, which is so simple to do, can help prevent really someone losing their vision, which is just, amazing that we now have the ability to do so. So preventative health screening, enforcing a better well-being of life is just going to be the thing that changes healthcare for us. It's going to change everything for a patient when it comes to affordability, quality of life, improved lifestyle, and frankly, longevity.
Justin, what would you like to add?
No, I think I just want to reinforce everything that was shared. I think that's spot on. I think kind of bringing some data to this conversation for Humana's membership in Hawaii, we're still seeing roughly 21% of our membership have not seen their PCP this year. And really kind of reinforcing everything that was shared previously from Dara, Matt, Colby, and Katie, but that it's important to kind of go in for that annual checkup and do those screenings and focus on your preventative health.
So I think a wrap up of that would be that preventative health is important. Screenings and wellness visits are a launching pad to come into the system to get appropriate care in a timely way. That we're seeing people that are not coming into their PCPs for a variety of reasons, which may be partially COVID related. And that there's been an explosion of technology. Dara gave us some great examples of what we can do in almost any setting to screen for things that make such a difference in our wellness and, you know, our quality of life. We had a question in the Q&A, and Katie, did you want to talk about RX for Food coupons?
Sure, no problem. So yeah, our Waianae Coast Comprehensive Health Center actually owns and operates Makeke Farmers Markets. So the coupons are given out and distributed by our health promotions department. So basically a patient will come in, we identified a food insecurity issue, and the provider can actually refer the patient to our health promotions department for these prescriptions of food coupons for them to fill at our various farmers markets throughout the west coast of Oahu. So that's how we do it.
Okay, great. Does anybody else have anything that they've thought of to add to this? And it's a very important topic. Did we miss anybody or anything? Okay. We've hit on some of this already, but I think it's an important kind of focusing question. How specifically can collaborative outreach efforts improve health equity here in Hawaii? And Dara, do you want to start?
Well, I could talk about this all day. Yes, with examples. COVID has just highlighted, exposed how important these collaborations are, these partnerships. And I'll give a few examples if that's okay. We've started with all of our grants to include partner stipends in them, recognizing that, we can't do everything. And there are other organizations that are doing incredible work that we want to also support. And as much as possible, we'd like it to be a team effort so that whenever we have a houseless patient, for example, whenever we have them engaged, we like to be able to ask them, what is most important to you right now? Usually it's not a COVID vaccine or, the thing that we're out there to give them. It's, food insecurity, shelter, and we want to make sure that we can respond. If we can't respond, have somebody right there with us who is able to help with housing placement, is able to help them with a SNAP application. And I think that's so important. We've seen with many of our organizations represented here, that holistic approach, addressing all of those social determinants of health. So we've included those partner stipends to show the importance to our funders and to encourage also our funders to make a change in the way that they're giving money to organizations, that if they're not working together with others, then that needs to be required, because we all can't do everything ourselves. I wanted to say that, we're really grateful to the Chaminade Nursing Program, because that collaborative outreach effort has been done together with your nursing students throughout COVID, when we needed more hands to be able to do more tests and to give more vaccines. Your nursing students and those within HPU as well responded to that call. The Medical Reserve Corps, many of our retired healthcare workers, we saw so many people come out and volunteer to help. It's important for us to have that educational outreach piece too. And like Colby mentioned, working with churches, working with local leaders, grassroots organizations, where we have minority leaders that are at the forefront. When we finally got into the Hawaiian Homes, for example, we utilized the leaders of the Hawaiian Homes to introduce us to each of the families and to do that door-to-door canvassing prior to the events, so that we could address any of that misinformation and start having those conversations, but with people that look like them, talk like them, understand what they're going through, and understand the hesitancy that they might be dealing with. The last thing I wanted to share is, and and giving some props to our team, but it's because of our partnership with the Department of Health that we were able to give the first vaccine at a pod here in Hawaii. And we've been really grateful and seen the importance of those public and private partnerships in order to react quickly, especially during emergency situations. And that was just the case when we, in late December, when we got notice less than a week before we needed to open a pod. 5 days they wanted us to open a pod. And so Department of Health obviously could get the vaccinations, but they didn't have access to 1cc syringes. They didn't have access to 25 gauge needles. And that was something that, without jumping through all the hoops that you have to within government, our nonprofit as a private organization was able to get those quickly from our partners. So COVID has been a great example of that GSD factor, how to get stuff done. You can replace that with a different word, but we've really seen that it takes like-minded organizations and like-minded individuals within different private and public entities to work together.
Thank you. Colby, do you want to address that?
Yeah, sure. And certainly we've talked a lot about organizations collaborating, but I think individuals can collaborate as well. And I think everyone who's on the on this webinar should know that it's everyone's responsibility to reach out and call up colleagues at other organizations, understand what other people in the value chain of the healthcare system does. If you're a provider, think about what the health plans do, and think about what the community health workers do. Think about what pharmacist roles are, or what other organizations in the system could do. By understanding what everyone's role is and what their scope is, I think it's easier for us to kind of make those connections. I think Hawaii is a really unique place. I don't think you would call up anyone and no one will not call you back, right? Someone will actually lend a hand. They actually probably want to learn more about what your organization does and what you can offer to them. And I think there's this shared interest in making everyone healthier in Hawaii. So I think don't be afraid to ever reach out to someone in other organizations. There's very few overlap in the state. And so everyone has to kind of work together, and it's on us to be leaders and step out of our boxes and make those connections by email, phone, going to events and making those connections for everyone's success.
That's a great reminder. It is a very collaborative and welcoming place, and people share what they have, even when their resources are not abundant. Katie, what do you want to add to that?
Again, I think collaborating with community partners is so important. There's several events that we hold throughout the year where we're doing things such as food distribution, and we have volunteers from faith organizations and volunteers from other nonprofit organizations that come and help us pass food out. So it's just great to work in collaboration with community partners, and also our health plans to work on different health disparities that we identify in our patients. And it takes all of us working together to provide the best care that we can to patients.
Thank you. Matt, what would you like to add to that conversation?
It's a great question, and Derek kind of said we could probably talk on this one for a long time as well. And I think COVID highlights this, and I'm sorry to keep bringing up COVID, but the pandemic shows us that healthcare is really, it's a right. It should not be a privilege for our community. And through that, we all have to work together as partners in our community to deliver on this healthcare. Healthcare, this may sound funny, but in my opinion, healthcare is not an exact process. I mean, healthcare is a flexible, it's a learning, it's a collaborative process, and that's why collaboration is key. And you probably heard it from all these panelists keep saying the word collaboration, because on the earlier point around public-private partnerships and how effective that is, that highlights the fact that healthcare is this ecosystem, and in the middle of this ecosystem is whether you call it the patient, the person, the community health. And the only way to make improvement, the only way to address that is really everybody coming to the table and working together. It's not a reliance on one widget, one key, one person, one group. It's a reliance on everybody. And that's just the way I think that we can work together to improve on health equity.
Justin, do you have anything that you want to add to that?
Yeah, and I'm going to take my human off and put my Hawaii Young Healthcare Professionals hat on. I think it's just healthcare is big, it's broad, it's general, it's very complicated and has a bunch of nuanced pieces. And I think it's so important where forums are created where people in the healthcare industry can really work together and collaborate and learn about like what does family services do, what does the March of Dimes do, like all these different healthcare organizations that really kind of put together towards community health, and understanding the scale of healthcare and how all interconnected we really are. That's so important to kind of lay the foundation of the collaboration which is needed to really provide like high quality, affordable healthcare for like the communities that we all live in. And it's so important. I think it's, the call to action is get involved, join a healthcare organization or committee, especially on what you're interested in. There's one's focused in the hospitals, one focused kind of on that more healthcare executive level, and there's some that are just in that general field of healthcare, which HYHP is. So really excited for this opportunity.
Thank you. In our last few minutes, I wanted to just summarize and see if any of the panelists had a final thought that they really wanted to share that somehow didn't make it into our discussion. And then we'll go to a few minutes of Q&A from our participants. I've heard we have significant challenges. Some were caused by COVID and some were uncovered by COVID, perhaps. We have new information, new technology that we're using. Everyone agrees on a holistic collaborative approach, whether it's around funding, writing a grant, planning care, delivering care, and that we have to be prepared to pivot quickly when we have an opportunity to provide care in a needed area, even if not something that we've done before. Project Vision is a perfect example of that. And just really watching out for each other and sharing those opportunities so that no stone goes unturned in helping our patients. Does anyone have any other final thoughts before we go to Q&A? Just go right ahead and speak up. Anything at all? Okay, you might have a final thought. Let's look to our participants and see what kind of Q&A questions we've gotten. One question was, how did we get into healthcare and how did we sort of land our first job? Dara, do you want to start with that?
I'm sorry, I was going to say, Dean, I would love to hear your answer to this question at the end, but yeah, I can go ahead and answer. I've been wanting to be in healthcare since I was 4 years old, so I always knew that that was the path I was going to take. Public health just came up when I went to Seattle for college and was surrounded by the Gates Foundation. I started doing a lot of volunteer work in middle school and high school, and I think that's how I ended up with my first job working with the American Cancer Society, but it was really the passion behind it. My brother had cancer when he was 4 years old, and I think utilizing that passion to fuel what you're going to do with your next steps. That's what really created my love for healthcare and why I'm still in it today.
Oh, thank you for sharing that. Colby, what about you?
Sure. In college, I spent every summer with a different type of health organization. One summer I was with a therapist, physiotherapy. I realized I didn't like that. The next summer I was with a surgeon. I realized I didn't like that, even though I got to see cool surgeries. And then the last summer before I graduated was with the Hawai Meth Project, a nonprofit public health organization. And I just loved it. They gave me the tools and skills to be successful in my role. And that ended up being my very first job. So they actually gave me a job after I hired. So that was nice. But just the organization that, it really takes business, communications, public speaking, being able to build relationships with policymakers. I mean, just such a wide, diverse range of skills that you can gain from this kind of role. That was my first job. And it was interesting, it was me sending emails out to, I think I sent the email to like 20 different organizations asking to be their intern, free labor. I got 3 emails back and one person actually said I can have, they'll take me, and they actually ended up paying me. And the person that hired me, Sydney Adams, who ended up being the Aloha United Way executive director for a while, CEO, is still my mentor today. So I think these early connections early on for students is great. So just don't be afraid to reach out to people, send emails, even though everyone may not respond or might be able to help you. Someone out there will be. So yeah, thanks.
And a nice point about mentors, long-term mentors can be so valuable. Katie, what brought you into healthcare?
My story is a little bit strange. I actually, my first career, I worked in military intelligence for the United States Air Force, but I'm from a family of nurses. My mother was a nurse. Everyone in my sister's a nurse who's now a nurse practitioner like myself. And kind of in my late 20s, I really felt I wanted to take care of people. So used my GI Bill to go to nursing school. And at that time, there was a huge nursing shortage. So I was able to get hired on really quickly. I think one of the challenges for people graduating now is they want everybody to have experience, which is why I love having the residency program. And I always encourage those of you who don't have nursing experience, we take both into our residency program. So people who have nursing experience and those who go straight through and get their doctorate in nurse practitioners, some of those have been my best nurse practitioners graduating from the program. So I just encourage everyone, if you have the opportunity to do a nurse practitioner residency program, that's great. But just be open when you graduate and apply for jobs that you want to do and that you're passionate about, and it will come.
Nice. Thank you. Matt, what brought you into healthcare?
Yeah, that's a great question. And, to be honest, initially, healthcare probably wasn't really on my radar. And then after going through undergrad and getting back here and, having to go on the job hunt, it kind of came down to reflecting on, I'm maybe like the fifth generation in my family to be part of the Hawaii community and wanting to make an impact on the community. That kind of helped guide me. And it led me to healthcare, because when you think about it, what are the industries and what are the things that you can do in the community that can have a significant impact across everybody? And I think healthcare is probably the one highest thing that you can do that can impact everybody in a positive way. And because of that, that's kind of what led me down into healthcare, what kept me here in healthcare. And, tip my hat to everybody on this call and all the NPs, the nurses, everybody that's here as a participant viewing. It comes down to the people. You meet such great people on this call that I've met. Dara, for example, I met all the way back in the beginning of my career, and we've been able to be friends ever since. And that's why I stay. And it's those two elements.
Nice. Justin, what about you?
Yeah, so I kind of fell into healthcare. I went to school in Colorado, and I wanted to come home, and there was an opening with Kaiser Permanente, so I didn't have to come back. And I started my career in Medicare and Medicaid finance, analytics, and strategy, and really getting to understand like the government program space and just like how important healthcare is for those two demographics, and like how important like affordability and access, and understanding like when someone has to pay a $500 surprise cost, how hard that is for someone on a fixed income or doesn't. And I think it just kind of really made me kind of fall in love with healthcare, and how do I help solve that affordability and access piece? Like, how can I use my energy every day to find a way to kind of help improve efficiency and reduce the cost of care without sacrificing the high quality of care that's delivered? And that's kind of what I look in the mirror every day. Why I get up is like, I want to be passionate, deliberate about improving access and affordability for healthcare, really in my home of Hawaii.
Absolutely. Well, since Dara opened the door for me, I'll answer, and then I'll ask Pam to answer last as she gives her thanks to everyone. I've been a nurse for over 45 years, but it feels like I've been in healthcare all my life because my mother was a nurse. And when I was about 5 years old, she stopped by the side of a road and she saved the life of a baby. And it still brings tears to my eyes to this day. And when we got back in the car, I said, "Mom, how did you know what to do?" And she said, "I'm a nurse." And it is the most wonderful thing in the world to have something that can help another person. And that made a big impression on me. And I think it's a good reminder that what all of us do is so important. We have a passion and we have a purpose. And that's a wonderful thing to have in life. And Pam, I'm going to turn it over to you.
Thank you so much. I too, from an early age, wanted to help others. I understand that my elementary school teachers would tell my mother that I was the first one to respond if someone had an owie or a boo-boo or wasn't doing well. And I think that just carried on. I actually ended up, I started my education with a degree in nutrition because I wanted to help others achieve wellness. And from there, I realized I could really expand my efforts by going to nursing school. So I took that experience from my first undergrad and I went into an accelerated nursing program where I just went straight through in my nursing courses. And that really enabled me to provide care to many masses of people in many settings, and opened my door then later, after a few years of experience, into becoming a nurse practitioner. So I think I've always had that passion and spark inside. And from there, I took the educational steps to make it happen. And as far as, getting into the job setting, really doing the best that you can, making the connections in your school setting, and then not being willing to take the risk and ask employers to hire you and show them what you've got when it's time to get into the career role. So I really want to take this opportunity. It's 1 o'clock now, so we're wrapping up. I want to take this opportunity to thank all of the attendees that came today to listen, and a special thanks to all of the panelists. Each one of you brings such remarkable expertise, background, and passions. And without you, this would not be possible. And a lot of the solutions in healthcare in Hawaii would not be possible. So I really want to thank you for everything that you're doing. So thank you so much. Please feel free to contact us with any questions. We'll post this recording at some point on our website so you can access it there. And I'm sure the panelists would be happy to, reach out to you at any time. If you would like to send me an email, you can go ahead and do so, and I'll connect you. All right. Thank you so much for your time, everyone. Aloha.
Thank you, everyone. Bye.
Aloha.